chief guest to create awareness about stroke among the Chennai public, a doctor and the IAS officer. Thank you, sir. And I'm deeply humbled to welcome all the world-class doctors, neurologists, neuroradiologists, neurosurgeons, everyone who have been providing this stroke service across the 3 hospitals in Kauvery. Without them, Kauvery is nothing. Thank you. Thank you. We all know in Kauvery at least, doctors are the best administrators. I don't think we can deny that. And that is in the medical healthcare field, we all know. But when a doctor like Dr. Vijayakarthikeyan becomes a public administrator, I think the benefit is going to be hugely for the society. So that's why the public awareness of stroke through a doctor who is an IAS officer, it's nothing can be better than this for this occasion, this World Stroke Day. And also, I want to congratulate Dr. Sivarajan on 10 years of association with Kauvery. Thank you. Thank you. I mean, as far as I can remember, Dr. Sivarajan was the first qualified stroke physician and neurologist to come to Chennai and start the stroke service. Thank you for being with us for 10 years and leading the stroke service. I remember when Dr. Sivarajan joined with us, how he created the stroke awareness first among the hospital staff. Even a group of 5 nurses or 10 nurses, whenever he goes for the ward, எல்லாத்தையும் கூப்பிட்டு அந்த be fast night சொல்லி கொடுப்பாரு. So then I saw after a few months, suddenly everywhere hospital flyers, posters, எல்லாமே what is fast, what is be fast, எல்லாமே அப்படின்னு சொல்லிட்டு. So even among the, one of the doctor told, heart attack we all know. But how many of the public know the brain attack? And even importantly, how many people in the hospital know about the stroke, early signs of stroke? I think within 6 months to 1 year, the hospital itself created this significant awareness about the stroke. And also from the ER, emergency department. Everybody knows what a stroke means. Thanks to you for bringing the stroke awareness. And there are several impediments to implement the very active, successful stroke program in a busy city, dense, highly populated Chennai city. The golden period, the 4.5 hours, does it apply to an Indian city? One can ask. But why not? When a Western country can have all the social infrastructure, medical infrastructure, to treat the patient within 4.5 hours, Chennai city also should have. That's why when I was speaking to Dr. Vijayakarthikeyan, we have heard about smart cities, smart Chennai, smart Coimbatore, smart Trichy, everywhere. We always talk about the physical infrastructure, like a road, and then public transport, train, buses, the connectivity, like IT connectivity. That's not smart city in the area. But what is important, most important to the public is the healthcare infrastructure. The healthcare infrastructure also should be part of any smart city program. That's why on this World Stroke Day, we have got this theme, time is action, time is brain, act fast. So we should also have a theme. How do we create a smart city, the Chennai, where people are generally stroke aware, and then if there are early symptoms of stroke, how fast they can reach a fully equipped hospital. So that should be our mission at least, how to create a stroke-conscious smart city, Chennai. I mean, we are fortunate in Kauvery to have 3 hospitals, all fully equipped in 3 different regions of Chennai, where people can easily reach. So, and it's not only the equipment which is available, the expertise. We have got from the first stroke physician 10 years back, we had Dr. Sivarajan. We have got more than a team of 15 people across these 3 hospitals doing this service. So my request for the media, particularly today, is why we should have a press meet. It's not to say that Kauvery has got the world-class stroke unit. The stroke awareness patti. I mean, how many of you, even common people, we all are aware about the heart attack. How many of us நமக்கு brain attack பத்தி தெரியும்? இந்த stroke பத்தி awareness create பண்றதுல வந்து ஊடகங்கள் பெரும் பங்கு வகிக்கும். So my request is please take the message to across the people, and thank you all. Thank you.
My colleagues from the medical fraternity, I'm very happy to be here. Always feel happy to be a part of any event that includes doctors. It always feels like a very close to heart function. I had the opportunity to listen to wonderful speeches given by all of you. It was very nice to learn about newer developments also. Like I said, at the outset, I'd like to first congratulate and thank Kauvery Hospitals for doing such a stellar job in tackling this humongous issue. The stroke அப்படிங்கிறது வந்து across நம்ம தமிழ்நாடு மட்டும் இல்லை, இந்தியா மட்டும் இல்லை, across the world it is a huge challenge that has to be tackled effectively. So one in every 40 seconds there is a stroke அப்படின்னு சொல்றாங்க. ஸோ இப்போ டாக்டர்ஸ் பேசும்போது சொன்னது என்னன்னா, லாஸ்ட் 2 years more than 1,000 people have been addressed அப்படிங்கிறது. It's a huge number considering the state, considering the country average. It's a huge service that you are doing to the society அப்படிங்கிறப்ப I feel very happy and proud of being here. So இது வந்து thanks to a wonderful team of doctors, technicians, all of you work here. ஏன்னா any issue or anything in a society, any challenge that can be overcome only with the support of everybody. It's not that government has to intervene, it's not that private sector has to intervene, it's not that community has to intervene. So எல்லாரும் சேர்ந்து செயல்படுறது அப்படிங்கிறது தான் வந்து எந்த ஒரு வெற்றிக்குமே வந்து வழிவகுக்கும். அந்த வகையில வந்து ஐ எம் வெரி ஹாப்பி தட் somebody like Kauvery Hospitals are doing their job. So the government will also do their part. Community also, we need to bring in the awareness so everybody can work together and mitigate this issue. So that way I'm very happy. பேசும்போது சொன்னாங்க டாக்டர் அரவிந்தன் வந்து all doctors are excellent administrators அப்படின்னு. I will fully agree that, fully accept that. ஏன் அப்படின்னா you have to make split second decisions. இப்போ பேசும்போது we just saw the presentation also. So நீங்க intervene பண்ணாலும் you put your needle in the groin, you have to see whether you have to suck it out or pull it out அப்படிங்கிறது வந்து you have to do it in a matter of seconds and you have to do it well. It requires skill, it requires immense knowledge and it requires decision making skills. இது வந்து எல்லாரும் பண்ண முடியாது. அக்ரி, எவ்ரி ப்ரொஃபஷன் தேர் இஸ் சம் டிசிஷன் மேக்கிங் இன்வால்வ். ஒரு குக்கா இருந்தாலும் அவங்க எக்ஸ்ட்ரா உப்பு போட்டாங்க அப்படின்னா ஃபுட் கெட்ஸ் சர்வ். பட் தென் இங்கே லைஃப் that is much more important. And the split second decision making, இது வந்து நான் ஏன் இவ்வளோ எலாபரேட் பண்ணுறேன்னா, also incidentally asked me during my UPSC interview, how can you contribute, what have you gained as a medical student? Really what I gained was the ability to make decisions on the spot in a timely manner. There was something I really realized after completing MBBS. So I will fully agree that all doctors are excellent decision makers and excellent administrators. So I will appreciate that. And on the smart city note, yes, it should be a holistic development. End of the day, infrastructure development is one thing, and having a healthy lifestyle and having a holistic, happy life is important. And that value addition to life is only possible with healthcare. So any development and any progress can be made only through proper healthcare facilities. I'm happy that we are in Chennai. Chennai is one of the pioneers in healthcare. People from across the country, across the world come here for treatment. So we should all be happy and privileged to be here. At the same time, take this message across so that everybody gets access to healthcare. வந்து ஒரு ஃபோனில் நமக்கு பசி வருது அப்படின்னா ஒரு இட்லியோ பிரியாணியோ பீட்சாவோ 20 மினிட்ஸில் நமக்கு வர தெரியுது, வரவைக்கு தெரியுது. பிகாஸ் we have access to the restaurants quickly. And the access வந்து we have to provide to healthcare also. Yeah, that's the role of everybody. That's the dream, ideal dream for us. So அந்த access, இப்போ நமக்கு ஒரு blood வேணுமா அப்படின்னா immediately we have to get the blood. Like how we get other things delivered. So on the ambulance, that has to be the goal to work towards achieving a global smart city. So one more thing, time, the essence of time has been very nicely addressed by Dr. K Vijayakarthikeyan, Dr. Satyanarayanan. All of you beautifully put forth your points. அதுதான் இப்போ வந்து எவ்ரி மினிட் கவுண்ட்ஸ் அப்படின்னு நம்ம சொல்றோம். இட் ஹாஸ் டு கம் டவுன் டு எவ்ரி செகண்ட் கவுண்ட்ஸ் அப்படின்ற அளவுக்கு we can further improvise, further value add. Now we've seen air ambulances, we've seen drone based therapies also. Thrombolytics have been sent in drones. I've read in certain media reports. So a lot of newer developments have come. அதான் the low molecular weight heparin எல்லாம் வந்து I used to study in textbooks. ஸோ இப்போ வந்து அட்டாக்ட் பிளேஸ் நிறைய நியூ ட்ரக்ஸ் வரும்போது there is still room for value adding. ஸோ டைம் we can save further. நிறைய நியூர் மொடாலிட்டிஸ் கொண்டு வரலாம், டிராஃபிக் மிட்டிகேட் பண்ணணும். Technology again keeps improving. We can also adapt to new technology. And third and the most important would be awareness, taking it to the people. So time we can do, technology also we can do, but then public has to come. It has to be a two-way street always. When we are all ready with all the infrastructure, effort has to come from that end also. அதை வந்து நம்ம பப்ளிக் எடுத்துட்டு போறது, பொதுமக்கள் ஒவ்வொருத்தருக்கும் இதை பத்தி சொல்றது. ஹார்ட் அட்டாக் அப்படின்றப்போ ஸ்ட்ரோக் அப்படிங்கிறது இப்போ தெரிய ஆரம்பிக்குது, பட் இன்னும் வந்து என்ன பண்ணணும் அப்படிங்கிறது நமக்கு தெரியணும். ஸ்ட்ரோக்னா என்ன, தலை சுத்தல் அப்படிங்கிறது எல்லாருக்கும் தெரியும், ஃபுட் பாய்சனிங்கா கூட இருக்கலாம். அது எப்படி டிஃபரன்ஷியேட் பண்றது, ஸ்ட்ரோக்கோடைய ஒரு முக்கியத்துவம் என்ன அப்படிங்கிறத எடுத்துட்டு போய் சொல்றது எல்லாரும் கேள்வி. நான் எப்படி வந்து எவ்ரி டாக்டர் இஸ் a good administrator, I would fully accept, but I will also tell more important role of a doctor is every doctor is an excellent teacher. So you also do the role of a teacher. So that is being done effectively. இதை எடுத்துட்டு போய் எல்லாத்தையும் போய் சொல்றதுல தான் our success is. So time, technology, thrombolysis, all these. இன்னொரு T வந்து டிராஃபிக், அது ஹெல்ப் பண்ணணும். That also we have to evolve. And the final T will be teamwork. So we all achieve this together. Happy and proud to be here. Let's make further progress in the coming years. Thanks a lot.